Good morning, everyone. Today, we are diving into the fascinating world of consumer psychology, a field that helps us understand why people make the choices they do when interacting with products, services, and even health systems. As we move through this session, we'll gradually build from foundational ideas to more applied concepts, especially those relevant to reproductive health. Let's begin by grounding ourselves in what consumer psychology actually means. Consumer psychology is the study of how people think, feel, and behave in relation to goods and services. To unpack this definition, it examines how people interpret information, it looks at what drives their decisions, it explores how emotions and social forces shape behavior. What is the importance of reproductive health? Understanding these dynamics is particularly useful in reproductive health care. Understanding needs, preferences, and behaviors. For example, knowing why people prefer private clinics for specific services can help professionals improve public facilities. Designing effective strategies to reach and persuade. When we know the factors that increase trust, we can craft communication that encourages early antenatal visits, contraception uptake, or follow-up care. Improving satisfaction and health outcomes. When services align with what clients value, such as privacy or fast service, overall satisfaction and adherence improve. Now that we've defined the field, the next logical step is to understand how people make decisions in the first place. Consumers typically move through 5 stages when making choices. 1. Problem recognition. This occurs when there's a gap between one's current state and desired state. For example, someone may realize they need a more reliable method of contraception. 2. Information search. Individuals look for possible solutions. Internal search, recalling personal experiences. External search, seeking advice from friends, the internet, or health workers. 3. Evaluation of alternatives. People compare options based on perceived benefits, risks, and costs. For instance, weighing the convenience of injectables versus the long-term coverage of implants. 4. Decision. The person chooses a product or service or decides not to act. 5. Post-purchase evaluation. After using the service, consumers reflect on their satisfaction. This stage strongly influences loyalty, repeat visits, and whether they recommend the service to others. With this decision cycle in mind, we can now explore the psychological forces that influence each step. There are 3 major psychological factors that shape consumer behavior. 1. Emotion. Feelings such as fear, comfort, or excitement affect how people process information. For example, reassuring visuals in a clinic can reduce anxiety and improve decision-making. 2. Motivation. Motivation is the internal or external drive behind actions. Understanding motives such as safety, convenience, or social acceptance helps segment audiences and tailor communication. 3. Attitudes. These are learned evaluations of services or products. Attitudes are shaped by experience, social influence, and perceived credibility. With these psychological foundations in place, we can now transition to the external social forces that shape consumer choices. Human behavior doesn't exist in a vacuum. Social and cultural contexts mold it. 1. Social norms. These are rules, spoken or unspoken, that guide expected behavior. For example, in some communities, discussing reproductive health openly may be discouraged, influencing service seeking. 2. Culture. Shared values, beliefs, and customs influence how people interpret health information. Marketing strategies must consider cultural sensitivity, language, and local values to reach and engage diverse audiences effectively. 3. Beliefs. Beliefs can be based on faith, tradition, or logic. Brands and health organizations that connect with core beliefs tend to build stronger trust and loyalty. These social forces operate in conjunction with demographic characteristics, which we discuss next. Several demographic factors shape consumer psychology. 1. Gender. Gender roles influence how people perceive risk, seek care, or express needs. For example, men may delay seeking care due to societal norms surrounding toughness. 2. Age and life stage. A teenager, an expectant mother, and an older adult each have different priorities and information needs. 3. Personality. Personality traits influence how consumers respond to stress and make decisions. A cautious person may prefer methods with frequent clinical follow-up, while a risk-tolerant individual may opt for more autonomous options. Now that we understand who the consumer is, let's explore how visual design influences behavior. Visual elements play a decisive role in capturing attention and shaping emotions, a concept often referred to as the sensory symphony. Blue evokes calmness, reliability, and trust. This is why many hospitals use blue in their branding. Green, associated with health, renewal, and natural balance. It's commonly used in wellness and environmental campaigns. Purple conveys sophistication, creativity, and uniqueness, used when brands want to appear premium or thoughtful. Beyond color, shapes also convey important psychological cues. Rounded shapes feel gentle, warm, and approachable. They're common in maternal and child health branding. Angular shapes appear strong, modern, and bold. They often appeal to audiences seeking precision or confidence. Completeness matters. Complete shapes communicate stability and trust. Incomplete shapes suggest movement and creativity, but can also imply uncertainty if misused. These visual cues influence how consumers make both quick and reflective decisions. Two types of choices dominate consumer decision-making. 1. Stimulus-based choices. These are driven by what consumers see in the moment, like a clinic's cleanliness, a poster design, or a website layout. Strategy. Prioritize visually appealing, accessible, and well-organized designs. 2. Memory-based choices. These rely on past experiences, reputation, or recommendations. For instance, a woman may return to the same clinic because the staff treated her kindly. Strategy: strengthen brand recall through quality service and positive experiences. Next, we look deeper into how marketing can strengthen memory. There are 3 major principles that improve memory retention. 1. Repetition. Seeing a message repeatedly makes it more recognizable and trustworthy. 2. Visual imagery and storytelling. Stories create emotional connections that stick in long-term memory. For example, campaigns that feature relatable characters or real-life narratives tend to be more memorable. 3. Positive association. Linking a brand to pleasant experiences, such as comfort, respect, and empowerment, enhances recall. These memory strategies influence how consumers perceive value. Perceived value isn't just about cost. It includes convenience, emotional comfort, and trust. Strategies to enhance value? Highlight hidden benefits. For example, emphasizing the peace of mind that comes from reliable contraceptive access. Personalized communication. Tailoring messages to specific age groups or motivations improves relevance. Showcase supportive services. Flexible hours, follow-up reminders, or friendly staff help build perceived value beyond the medical service itself. Substantial perceived value improves overall brand perception. Brand perception is shaped by ethical behavior and authentic engagement. Ethical considerations: avoid manipulative tactics such as fear-based messaging. Ensure transparent communication about risks and benefits. Building trust: demonstrate empathy in patient interactions. Show social responsibility, such as community outreach. Maintain open communication. Authenticity helps build long-term relationships with consumers, particularly in sensitive fields such as reproductive health. At this point, I'd be happy to hear your questions, comments, or reflections on the topic.